Hello and welcome back to the Ghana Mental Health Alliance. In our previous discussion, we explored the major causes of mental disorder.
We are here again to discuss another heartfelt concern about mental health. Today, we shall look at the major challenges facing mental health care and its supports in Ghana.
Join us as we continue to raise awareness, promote understanding, and advocate for improved mental health support in Ghana.
According to the Ministry of Health, 41% of Ghanaians have psychological distress, which is either mild, moderate, or severe.
And also, data provided by the Ministry of Health in 2021 reveals that a total number of 3.1 million Ghanaian, representing 10% of the country population, are living with mental disorders.
The challenges facing mental health care in Ghana are deeply intertwined and highlight a systemic issue that requires urgent attention. Among these, stigma and social discrimination could be considered the most pressing challenge due to its pervasive impact on individuals seeking help and the overall perception of mental health in society. Stigma can lead to 1. Barriers to seeking help. Stigma leads to fear of judgment and discrimination, making individuals reluctant to seek help for their mental health issues. This can exacerbate their conditions and prevent early interventions. 2. Social exclusion. Those who disclose their mental health status often face criticism from family, friends, and the community, leading to isolation and worsening mental health outcomes. 3. Influence on policy and funding. Stigma can affect policy decisions and funding allocations, as mental health may be deprioritized in favor of other health issues that are viewed more favorably. Addressing stigma and discrimination is essential to create a more supportive environment that encourages individuals to seek help, ultimately leading to improved mental health outcomes.
Another major challenge facing mental health care and its supports in Ghana is limited access to care. Only 2% of the 2.3 million people living with mental health conditions in Ghana receive psychiatric treatment and support. Many individuals are left without necessary resources or professional guidance due to the lack of accessible and affordable mental health services. Addressing this gap requires concerted efforts from the government, non-profit organizations, and the community to destigmatize mental health issues and enhance the availability of treatment and support networks.
Ghana's mental health infrastructure is critically limited, with only 3 major psychiatric hospitals, including Anchor Falls Psychiatric Hospital, which is the first in West Africa, and a key training ground for health practitioners. These hospitals require urgent renovations as they face significant challenges such as aging buildings, outdated facilities, and a lack of essential medical supplies, which hinder modern psychiatric care. Despite these issues, staff remain committed to providing care. Funding and support from government and NGOs are crucial for improvements. Integrating mental health services into general health care across all facilities, from community health posts to teaching hospitals, is essential for enhancing mental health care and fostering a healthier environment for all citizens.
Human rights violations, reports of coercion, forced treatment, and mistreatment of people with mental health conditions are common. Statistics indicate that a lot of individuals living with mental health conditions are often abused by faith-based healers, community leaders, family and friends. These abuses are very intensive, which worsens the occurrence of mental disorders for the affected individuals. To address these challenges, initiatives like the World Health Organization's WHO Special Initiative for Mental Health and the Quality Rights Initiative are working to improve access to quality mental health care, promote human rights, and provide training for mental health professionals and community members.
Mental health care in Ghana is hindered by several significant challenges. 1. Stigma and discrimination. Widespread stigma discourages individuals from seeking help. 2. Limited resources. There is a shortage of professionals, facilities, and funding. 3. Lack of awareness. Many people are unaware of mental health issues, leading to neglect. 4. Inadequate policy implementation. Existing policies are often poorly implemented, resulting in service gaps. 5. Cultural beliefs. Traditional beliefs can deter people from seeking conventional treatment. 6. Accessibility issues. Rural areas face significant barriers to accessing mental health services. 7. Integration with primary care. Poor integration with primary health care limits comprehensive treatment. Addressing these challenges requires a comprehensive approach focused on education, policy reform, and resource allocation to meet the mental health needs of all Ghanaians.
Addressing the challenges facing mental health care in Ghana is crucial for improving the population's well-being. Tackling stigma, enhancing resource allocation, raising awareness, and implementing effective policies are key steps.
Integrating mental health services with primary care and respecting cultural beliefs will promote a holistic approach. Stakeholders, including the government, health professionals, and communities, must collaborate to prioritize mental health, ensuring everyone has access to care and support. Together, we can create a healthier and more inclusive society.
Mental health matters, speak up. Seek help. Ghana Mental Health Alliance, breaking barriers, building resilience. Thank you.
Thank you very much for listening. Please subscribe to our YouTube channel, like our videos, and leave your comments. We appreciate you.